Welcome everyone. Good morning and welcome all of you to Care Center's 2025 Nursing Week events, celebrating the power of nurses to transform health. My name is Bessie Nasiopoulos and I'm a case manager and professional development lead here at Care Center. And I have the privilege and honor of welcoming you all to our opening day one of events titled A Powerful Story from the Bedside, the Healing Actions of Words Unspoken. A big thank you to our panelists and speakers. Thank you for sharing your time and expertise with us. Your insights undoubtedly spark inspiration and new ideas for all of us. To our Care Center team, your support and endless work has made this incredible event possible, celebrating successful transformation stories. And to all attendees, to all of you, thank you for taking the time out of your busy schedules to be here with us today, as your presence and enthusiasm is truly motivating. We have a lineup of amazing speakers that will definitely impress you all. But before we get started, we would like to take a minute to acknowledge our land. We acknowledge that we are gathered on the traditional territories of Indigenous peoples who are the past, present, and future caretakers of this land that we call Canada. We acknowledge that we are gathered today virtually for Care Center's 2025 Nursing Week events, with participants attending from coast to coast on the ancestral and unceded territories of First Nations, Inuit, and Métis peoples. We respect and affirm the inherent and treaty rights of all Indigenous peoples across this land. We recognize that we each have a role to play in the path to decolonization and ask you to take this moment to reflect upon and acknowledge the harms and mistakes of the past and to consider how we can each, in our own way, move forward in a spirit of reconciliation and collaboration. Now, ladies and gentlemen, imagine someone who's not just mastered their field, but transformed it, transforming challenges into triumphs. That is our Executive Director, Dr. Ruth Lee. With a career spanning over decades, she has earned accolades like the recent prestigious King Charles III Coronation Medal by the Canadian Nurses Association. We are extremely proud to celebrate the outstanding achievements and her passion in championing excellence in nursing care and embracing diversity. If your schedule permits, please join us with the Canadian Nurses Association on Friday, May 16th at 12 noon during this special celebration, recognizing the recipients of the King Charles III Coronation Medal, and I will be putting in the registration link in the chat box very shortly. As the Executive Director of Care Center for Internationally Educated Nurses, Ruth works closely with regulators, employers, professional organizations, and academics to support internationally educated nurses' integration process. She's an associate clinical professor at McMaster University School of Nursing, Hamilton, Ontario, Canada, where she's a faculty member of the graduate program since 2003. Ruth obtained her registered nurse diploma from Seneca College, bachelor's and master's degree from the Faculty of Nursing, University of Toronto, and her PhD from the Institute of Medical Sciences, Faculty of Medicine, University of Toronto. Prior to joining Care Center 8 years ago, Ruth was the Chief of Nursing Practice, Hamilton Health Sciences, for 13 years, where she led the Internationally Educated Nurses Integration Project. Ruth's clinical and administrative expertise spans many roles in various healthcare settings, acute, community, and long-term care. Her academic and knowledge translation work focus on culturally competent practice, diversity and inclusion, leadership and management, and health human resources planning, including internationally educated nurses. Ruth was also awarded a Lifetime Achievement Award by the Registered Nurses Association of Ontario in 2018 for her outstanding contributions to the nursing profession. Without further ado, let's welcome Dr. Ruth Lee.
Well, thank you so much, Bessie, for those very, very, very kind words. I'm truly humble and truly surprised by receiving the award, because I'm basically following my passion, and I cannot say thank you enough for all the people who have supported me throughout my journey in nursing. And I'm sure there's many, many well-deserved people, including my very dear colleague, Dr. Karima Welje, whom I have worked closely when we were at the UHN many, many years ago. And it's all those colleagues who have supported me that I'm truly, truly grateful. So this is something that we all celebrate. The theme of this year's Nursing Week is the power of nurses to transform care. So I think that's what we're about. This is something that we all need to remember as nurses. We also change agents that will make a difference in all of our patients' lives. And not to mention, we are so fortunate to be part of this beautiful land. Many of us chose to come to Canada and chose to contribute to Canada. And we are absolutely uh, grateful to all the hard work that everybody's do. And I'm truly humble to have the privilege to lead this organization and to work with many, many of my colleagues who are so devoted and to witness the success of many internationally educated nurses. I often jokingly, but not really joking, is that I'm not good enough to be an IEN because I'm not able to get into nursing school in my home country. It's very tough to get into nursing. If people think that IEN is not as good as Canadian educated nurses, I will say think twice because it takes special people to come to a new land. And we as Canadian, we're so honored and privileged to welcome the treasure of the land, of the world to our land. So on that, I'm truly, truly grateful. So hopefully we will work together and so much work waiting for us to do so. Um, so today we have a full week actually to kick off the full week. And so before I introduce Karima to kick it off, I just like to acknowledge the contribution of the funder, actually, the government of Ontario and the government of Canada, who both recently granted us new funding to make our work possible, to continue our service to all the IENs and our stakeholders. What's even more exciting is that many of you know that since um, I would say at least 6, 7 years ago when I first joined Care Center, I've been advocating to have post-arrival services be available across the nation. And I can tell you we have good news. April 1 of this year, we got funding to not just do pre-arrival services. We have our PASS program is now called pre and post arrival support and services. So Care Center has grown. And I'm delighted in baby steps. We're spreading our wings to support as many IENs as we possibly can. And my famous line, I do not want nurses that come to this land do anything but nursing because that's their passion, it's our passion. And we have the honor here to work with all the folks in all categories, including wonderful people like Karima, the government, the academic institutions, the settlement agencies, but most importantly, the employers who actually give employment opportunities to our IEN members in their journey to get their registration and beyond. So we are very privileged to have over 7,000 IEN members that is part of Care Center. And they all know that Care Center is their home. We have a lifetime membership. So many of them started to get their license as an RPN and then move into RN and then NP and beyond. Two of our care members who actually completed their programming with us is now on our board, and they both have the doctorate. So since they joined us, so I'm extremely humble to see those success stories, and that kind of enforce my team and my work in supporting them. So on that, in addition to the funder that allow us to do the work, and of course, all my team work with their heart. There's no money. We don't pay them well, I can confess to that, but they work with their heart. They're committed. I'm very, very honored to be part of this wonderful team. And also thank our 7,000 plus members for your continued support. You keep on coming back and tell us that please call me up when there's anything I can be of help. So for that, I'm really grateful. Our partners, as I mentioned. So very, very excited to kick off this week by welcoming my dear friend, Dr. Karima to deliver opening remarks for what week-long celebration. And other than a personal relationship, I must say that Karima is someone I truly admire of her courage, and she's tirelessly advocating for all nurses. IEN is very much that group of nurses she advocate, and she value diversity, and she's just a champion. So we met in our days as advanced practice nurses way back at the UHN days. So you can see that Karima truly know what patient care is all about, administration. So I would call her my encyclopedia about nursing. So right now, Karima, we're very privileged to be living in Ontario, that she is the Chief of Nursing and Professional Practice and an Assistant Deputy Minister for Ontario. She's leading the integrated health human strategy for the province of Ontario, which includes a focus on education expansion, clinical support, including creation of 2 new medical schools, school of practice expansion, including pharmacy, minor element programs, and RN prescribing, expediting pathways for jurisdictional and international practitioners, including launching practice-ready assessment program and operationalize the as of right legislation, and retention and distribution programs, including locums, clinical scholars, and extern programs. She's a registered nurse and has held senior leadership positions in several academic health science centers and boards. She is course-appointed to a number, it's too long a list of universities that she's been course-appointed with, and she has received an honorary degree from Loyalist College. Dr. LJ is a sought-after consultant for system-level projects and has led external reviews of several organizations. She's a surveyor with the Health Standards of Organization, Accreditation Canada, and most importantly to CAT Center. She's a wonderful, wonderful champion and supporter. So welcome, Karima. We are anxious to hear your words of wisdom to kick off our celebration of Nursing Week this year.
Thank you so much, Ruth. Thank you to the Care Center for all the work that you do. It speaks to my soul. We are so aligned in our values, in the work you do, and I do believe people have a right to rise to their true potential, and furthermore, we need them in our system. So there is no doubt we share our desire to give people their true opportunity to be who they are, nurses in the system. Also want to acknowledge the Indigenous lands that we all gather on, and to really honor the spirit and the actions of truth and reconciliation. I want to start all my Nursing Week events this year, by saying thank you. Thank you to all of you on the ground who actually do the work. It's hard enough, frankly, to actually come up with the policies, the funding, to move the work from top down. But if there wasn't uptake or advocacy that's happening on the ground, that work would not be what it is. And all of you who are on this webinar have made it happen. Really, really thank you. Big thank you for all your efforts. I wanted to say to you, and I will support this with data, that Ontario is the best place to practice nursing here and now. And I want to tell you why that is the case. First and foremost, we have the most evolved scope of practice for nursing. As we sit in the country today, we are thriving with our scope work. It's not to say it's 100% there, but it's there. So we've touched all the 3 roles of nursing with scope of practice expansion. As you know, we started with RPNs actually, and implemented RPN initiation in Ontario, which means RPNs exercising their own unique independent knowledge and skill and initiating nursing treatments for patients in settings like long-term care where there is stability of patients. So cool to see that we recognize their education and their expanded, honestly, scope and knowledge that they already have. Then we proceeded to evolve further the nurse practitioner scope of practice, and that further expanded scope. We were always forefront with NP scope of practice in Ontario, but we went 2 or 3 steps ahead and further removed barriers so that NPs enjoy a very, very independent scope of practice. I'm a nurse practitioner by background, and I'll tell you, for actually most of my nurse practitioner career, I practiced under medical directives. 40 radiation oncologists had to sign off on my medical directives for me to assess patients, prescribe medications, tests for complex symptoms, but I could not exercise that with my unique knowledge, skills independently. And now we are doing independent scope of practice of nurse practitioners, particularly in the primary care setting, and I'll come back to it. And then, of course, finally, after how many years of fighting from outside, we actually implemented RN prescribing in Ontario. So, you know, why increase scope? It increases access for the population. It gives them a choice from who they want to receive care, but it allows people to also rise to their true potential, to their knowledge, to their skill, and to be the maximum of who they are, which is all our right to be those, our maximum of who we are. So very proud of it. And I think as of now, we have 650 RN prescribers in Ontario, and we want more. We want more. Associated with this, you've seen our recent work on primary care. So again, we are the first province that has legislated primary care as a right of citizens, that 100% of citizens in Ontario should be attached to the primary care system. And it's their right to be attached. And we have a very cool physician, actually, Dr. Jane Philpott, who's leading the charge on it, but who really believes in interprofessional work. So in that work, you will see the definition of attachment is attachment to a physician or nurse practitioner. That is what attachment means. So NPs getting very equalized with the family physician role in our primary care system, the foundation basically of our system. So it's a very cool transformation that will now start to take place. The more we make primary care the foundation, the less we will have people ending up in Emerge who don't need to be there. The wait time in Emerge will start to hopefully go down. It's all the idea of serving people in the best possible way, guided by clinical knowledge, clinical work. So not a bureaucratic system, a system that works clinically. I'm very, very, very proud of that achievement as well, an equal position for NPs in the primary care system. Second reason why Ontario is the best place to practice nursing is we have the best and the largest education expansion that's underway for all 3 roles of nursing. So we have 2,000 additional nursing RN seats we've added to the system, 1,000 RPN seats, and 150 nurse practitioner seats. We almost doubled the number of NP seats in the province. And once again, all the seats are alive. They have been active for the last 2.5 years. And the first cohort from that expansion has already graduated in 2024. The RPNs were the first group that graduated from that cohort. So the idea here is domestic expansion. As much as I'm very much a believer of ethical recruitment. Never should we go and steal anyone's HHR from any country. But if they wish to be here or they're already here, they should live their true potential. Absolutely, that's the approach. But in order to do that, we must grow our domestic workforce equally on our side as well, because the needs outweigh the supply that we have now and going into the future. So there is no stone we should leave unturned to create the nursing capacity that we need. So I'll come to numbers in a second. Third reason why we are a very good place to practice nursing in all of its domains is your work. The work of expediting pathways to registration for international and interjurisdictional practitioners. Folks, you know this better than me, so I won't harp about it, but we are a shining province. We are a leader province. Thanks to you, thanks to all of us who believe in this work remarkably. But we have not only systematically removed barriers of registration, we've created legislative and regulatory approaches to ensure pathways are expedited. It started with the college actually getting a minister's directive. Just as I was arriving in the ministry, we issued a directive to the two colleges, physicians and nurses, to say, folks, it's taking too long to register people. This is immoral. We are not doing right by the people who are paying a lot of money to become who they already are in the system. And furthermore, it's taking too long to register them. So kudos to our College of Nurses who have gone way and beyond what we suggested in that direction letter and who lead our own thinking. So I urge you folks, we don't steal anyone's HHR. We don't have any country-to-country contract with anybody. The minute we do that, I will leave. The ministry, I've told that to the minister. I don't believe in stealing people's HHR. I'm an immigrant to Canada. I'm not going to steal nurses from Tanzania, where I came from. I won't. But if a nurse from Tanzania is here or wishes to be here, surely it's our job to make sure they become nurses. In Ontario, we need them. We need them to boot. So beautiful work on education equivalence that the college has now led. No one told them to lead that. They did it themselves. I have to acknowledge that work. If you have a degree in nursing from anywhere in the world, we don't even have a list of countries. We should be so proud of that. We are agnostic to countries. If you have a degree, it's an equivalent education program, we will recognize that degree in Ontario. If you have a diploma as an RPN, we'll recognize that diploma. And if you don't have any of that, we will make sure there is still an expedited path for you to get your upgrading done, and then you become nurses in our system. It's very cool work. And then look at the announcement of 2 weeks ago on labor mobility in Ontario. First in the province. We are going to recognize interjurisdictional within Canada nurses as if there was a national licensure in place. We didn't wait for all provinces to line up because we will turn blue if we wait. We've just gone ahead and become first movers. And then lastly, we have a lot of our last pillar is retention and distribution. And all the programs that Ruth mentioned in the introduction are alive and well. There are 15 or so programs geared to nursing, bridging programs, externship programs, clinical scholar, programs directed to ensuring care organizations to ensure the nurses stay and the nurses distribute in the right places in the province. It's actually very beautiful. The numbers are moving in the right direction, guys. Not every provinces can say every year for the last 3, 4, 5 years, we've been increasing the number of new registrations in nursing in the province. Our last number was over 18,000, almost half of whom were international nurses. Like, how cool is that? And then year over year, our net increase after you take attrition out has been increasing by almost 6,000 nurses. Like, that is unheard of, folks. We have to celebrate that. You know, when people say, it sometimes really bothers me that when we just keep on repeating the same rhetoric in the media, a negative view of nursing, or the sky is falling, or the profession is falling apart, no one wants to be a nurse. There is no data to support that, folks. I was looking at Coupon's data recently, the schools of nursing. We turn 75% of candidates away. We fill all our nursing seats. And 75% of candidates are not allowed into nursing seats. So we have more room for expansion, frankly. It's huge. We are an attractive profession. Our profession is growing. Retention is good. At least in the hospital setting, we have stabilized now vacancies and systemic vacancies to the level of pre-pandemic. Huge. We've turned the corner. We went through a significant crisis. There is no doubt. But we've turned the corner. And my appeal to nurse leaders, all of you in the webinar, is start to sing the story of nursing in positive ways, portray the work of nurses positively, tell the stories of international nurses and the lives you've changed, and tell us what they are doing in the system, how their lives changed. My life changed when I came to Canada completely. Nursing lifted me and my family out of poverty. I'm very thankful to the profession. We have to use data to tell our stories. We must use data to tell our stories because otherwise it's rhetoric. No one will listen. No one wants to only listen to negative talk, frankly. It's not to say if there are workload issues, we shouldn't talk about it. Of course we should. But at the same time, don't make the work of nursing invisible. Celebrate that beautiful work of nursing. Humanly, you want to turn to a positive view of the world. And I want to be a positive storyteller, not a denier, because we are working on things. Believe me, I've never worked as hard as I'm doing now in my 60s, because the doors are open. The doors are open and we are getting the support we need, folks. So big thank you. Go away into Nursing Week and onwards with a very positive vibe about our profession. I love it. I know you love it. I know Ruth loves it. If all of us start to create a ripple story of nursing in a positive way, the wave, no one can stop the wave of transformation, which is the theme of Nursing Week. Thank you so much.
Thank you, Karima, for those words of wisdom. I particularly take it to heart of your comment that no one wants to listen to negative words. That is very telling. Life is, to me, is a glass half full, half empty. So if we can magnify that positive, then get people to listen to us, and basically so the strength of nursing, the strength of IENs. I'm often joke that our team allow our IEN members to vent, get some of those negative out of the way for the first half an hour, and okay, get to work now. Right? So I think that's the thing that I'm really grateful that you really hit the nail on the head, that we need to capitalize on the positive and move forward and work together as well. We're very fortunate to be in Canada. As an immigrant myself, I was just telling Ken, our keynote speaker today, about how beautiful the garden, the Butcher Garden in Victoria is, that it reflects what diversity is all about. Is the positive, and how we can minimize the negative to make the positive even more, right? So thank you so much. And I'm so humble and grateful that in the work with the regulators, many of the things that we have proposed and we have worked together become reality. And I'm about to mention that in my introduction to Ruth Wojcik, we call her Ruth Winner in Care Center, about the tireless work that she have done to make many of those initiatives become reality. And we are very happy also that the transition to practice requirement now, I call it the number 9 requirement in Ontario. 2 of those initiatives, one by U of T and the other one by TMU, are supported by our programming. And also many facilitators, actually our team members, case managers. So we're very proud of the work that we do to make nursing become a profession of choice. And you're absolutely right. We should not steal anybody's nurses because they're precious. But if they so desire to choose Canada to be their new home, we are here to make sure that they are not doing anything else but nursing. And my team often worry that one day Ruth will be sued by naming certain coffee shops, because I said, please, many people can do the pouring the coffee, but we don't need nurses to do that. So I'm very grateful to employer partners of Care Center. We make sure they work within the healthcare sector before they get their license. And then once they get their license, they will return to nursing. So thank you, Karima, for your words of wisdom. They all come from your heart. Knowing you for all these years, you never change, and you mean every word that you say. So thank you so much again, and
Thank
I hope that
you.
your calendar will allow you to stay with us. But if not, do feel free to get on your busy schedule. Again, cannot say thank you enough of starting Nursing Week with Care Center. Much,
Yes,
much appreciated.
3 years in a row.
Yes, yes. So just show you the commitment to IENs in action. Thank you so much.
Thank you.
So
I'm heading
yeah,
off to speak to the corrections nurses, so forgive me that I have to venture off, but thank you for all your work, folks. And thank you.
thank you. Yeah.
Take care.
So
Bye-bye.
yeah, you have a wonderful week. You're one
Take care.
proud nurse. Yeah, the champion for all of us. Take care.
Thank you.
So unfortunately, Dr. Lee Chapman, the chief nurse of Canada, is not able to join us today, but she has sent us a video to start the celebration with all of you as well. So Dr. Lee Chapman was named in 2023 as one of Maclean Magazine's top 10 healthcare innovators and as one of the 50 most influential Torontonians. So for those of you Torontonians, you know that she's one proud citizen of Toronto. So Dr. Lee Chapman is a leader within the field of nursing and healthcare. She's a registered nurse with over 20 years of experience. Over her course of career, Lee has gained a deep understanding of nursing through her work in both frontline and clinical leadership capacities. Her professional experience spans various settings, including clinical care, education, research, professional practice, administration, policy, and advocacy. After obtaining her BSc and also master's in clinical health science from the nursing graduate program at McMaster University. That's where our path crossed when I was there at McMaster. She's one outstanding student as well as a nurse working at Hamilton Health Sciences. So Lee then completed her doctoral work in 2019 at the Lawrence Bloomberg Schools of Nursing at the Faculty of Nursing, my apologies, at the University of Toronto. Her research provides key insight into ways in which the regulation of health professionals intersects with organizational priorities in acute care settings. So as Chief Nursing Officer, Lee recognizes the important contributions of nurses at the federal level and aims to ensure their integration into decisions impacting the profession. Within her role, Lee provides strategic advice from a nursing perspective on priority policy and program areas. She plays a convincing role with provincial and territorial governments, federal departments, regulatory bodies and colleges, educators, and others on key nursing issues. Additionally, Lee represents the Government of Canada at public forums, both within and outside of Canada. Lee is committed to advancing the nursing profession in Canada to ensure equitable access to safe, quality care for all. So on that, Nicholas, would you please play the video that Lee has shared with us?
This week is National Nursing Week, a time to celebrate and acknowledge nurses, the first point of contact for many people when receiving health care. Today, I'm meeting with nurses at Briere Health St. Vincent Hospital in Ottawa, which offers specialized services for patients with complex needs. As Canada's Chief Nursing Officer, I see firsthand the positive impact nurses make and how they can transform not only the health of their patients and communities, but also the healthcare system. A stronger and more sustainable healthcare system needs empowered nurses. This is why, together with the nursing community, the Nursing Retention Toolkit was developed to help support nurses, keep them in the profession, and improve their working lives. Since its release, nursing employers and health authorities across Canada are implementing various initiatives within the toolkit, like here at Briere Health, where they have incorporated it into their hospital-wide strategic plan. Visit canada.ca/nursing toolkit if you want to learn more. On behalf of the Government of Canada, thank you, nurses, for your dedication and contribution to better healthcare.
The next person that I'd like to introduce is Dr. Valerie Gardisa. She is the chief nursing, she's the CEO of the Canadian Nurses Association. Unfortunately, she's not able to be with us as well because that's after all the first hour almost of the work week and celebration of Nursing Week. But Valerie have also shared her greetings in a recorded video to share. So let me introduce her first, and then we can play that video. So Dr. Valerie Gardisa brings over 30 years of diverse experience across public, private, not-for-profit, and senior government roles. With deep knowledge of Canada's health system, she has worked in Alberta and Ontario and served in various capacities in 11 out of the 13 provinces and territories of Canada, including the federal government as well. She has led transformation initiatives focused on care system redesign, health and human service integration, and workforce strategies, both nationally and internationally. Beginning her nursing career in 1988 at Mount Sinai Hospital in Toronto, not very far from Care Center's office, Valerie has held roles from NP, an RN to clinical educator, senior management, and chief nursing executive. Her extensive academic background includes faculty appointments at 7 Canadian universities and a focus on health and human resources integration. Previously, she served as CEO of the Canadian Mental Health Association, Simcoe County branch. She's committed to optimizing the role of regulated nurses and ensuring the voice of almost 500,000 nurses and nursing students are heard. She is dedicated to advancing national nursing and health policy in collaboration with the board of directors, Canadian Nurse Association members, and partners across Canada. So Valerie is a new CEO. We have met Valerie and Tim before, so this is the third CEO of the Canadian Nurse Association that joined in our celebration. So Nicholas, please play the message from Valerie.
Hello, I am Valerie Gardisa, CEO of the Canadian Nurses Association, and I am so pleased to be part of this special celebration with you. National Nursing Week takes place from May 12th to the 18th, and this year's theme, The Power of Nurses to Transform Health, is an important reminder of the vital role nurses play every day. Nurses are not only at the heart and mind of compassionate care, they're leaders, innovators, and advocates shaping the future of healthcare. A big thank you to the Care Center for Internationally Educated Nurses for the invitation to share a few words. Your ongoing work to support internationally educated nurses is essential to building a strong, inclusive, and diverse nursing workforce in Canada. To all the IENs in Canada, your dedication, expertise, and experience are a gift to our health system. You bring so much value to our profession, and we are proud to have you as part of the Canadian nursing community and family. At CNA, we're here to support you. When you join CNA, you become a part of a national network of nurses representing more than 470,000 individuals working to advance our profession, support one another, and transform healthcare across the nation, leading the way together. On behalf of everyone at CNA, thank you for everything you do. And once again, happy National Nursing Week 2025.
So it just gives me such great pleasure to introduce our next person who's going to introduce our keynote speaker, Ken Saltis. So this very important person in Care Center is Ruth Wychuck. Ruth is someone we all admire at Care Center. And at Care Center, we have this joke. There's 2 Ruth in the house, and one winner and one loser. So here's Ruth Wychuck, the winner, the wise woman, and here's Ruth Lee, the loser. So Ruth been a very devoted person to IEN in general, and very devoted member of the Care Center family. So Ruth been in nurse, like she's our encyclopedia, actually. If you don't know anything, you go to Ruth Wychuck. She have lived experience of 6 decades of nursing career. span from community, acute care administration, and teaching. In her role as professional practice lead at CARE Center for Internationally Educated Nurses, she supports IEN within the federally funded pre and post-arrival services. As I mentioned earlier, the new PASS program, pre and post support and services, and also the provincially funded STARS program on their journey to registration and employment. So CARE Center initiative focus on addressing the multiple challenges faced by internationally educated nurses as they prepare for licensure and workforce reentry, while supporting healthcare employers to create an inclusive, welcoming workplace environment. I have the privilege to co-author an article and publish in Nursing Leadership in 2021 called Transition of International Educated Nurses into Practice, What We Need to Do to Evolve as an Inclusive Profession over the next decade. So Ruth is a star. She is so committed to workplace integration, not just getting nurses their license, but also become the fabric of the Canadian healthcare workforce. So many tips is in that article, and then those tips actually being implemented across the province and beyond with the work that Ruth's been doing in the CARE Center's workplace integration program. So Ruth, please introduce our keynote speaker, and again, my thanks in Nursing Week to you for your commitment and dedication to nursing in general and to CARE Center close to the family at heart. Thank you, Ruth.
I would like to jump in before that and mention something. So thank you to both Ruths. I would say we have Ruth Wise and Ruth Leader. So you both winners at the end. And we are actually fortunate and the winners to have you both leading and being sailing the ship smoothly at CARE Center. So thanks for everyone and thank you again.
Thank you, Rola, for that very kind words. Rola is a program manager for our Ontario-funded STARS program. So she will be chairing tomorrow's session. Okay, Ruth, without further ado, please introduce up-and-coming star, Kent.
Yes, thank you, Ruth, for that kind introduction. It is really, first of all, I want to say Happy Nurses Week to everybody who's here, to all those who've joined us, and of course to our distinguished panelists and speakers. So on this first day of CARE Center's Nurses Week celebration, it's really my distinct pleasure to introduce our keynote speaker, Kent Saltis. Kent, who lives and works on Vancouver Island, is a dedicated nurse, a leader, an educator, a researcher, and an advocate for innovation in nursing education and leadership. But beyond his professional life, Kent, a devoted husband and father, finds one of his greatest joys in the out of doors, exploring the natural beauty of Vancouver Island. And we've also just learned recently, he explores the natural beauty of Ontario as well. I first became aware of Kent when I read his most recent published work, a very inspiring personal story in the January edition of the Canadian Nurse, entitled On the Other Side of the Curtain, Why What We Say When We Think No One Can Hear Matters, the basis of Kent's inspiring presentation this morning. His accomplishments are dauntingly numerous, as is his unrelenting commitment to shaping the future of nursing. In recognition of his contribution to nursing, he was honored with the 2024 Outstanding Alumni Award from Mount Royal University. I invite you to enjoy the following award video, which captures much more eloquently than I ever can the essence of Kent, the man and the nurse.
Kent Saltis's path has shaped many others. Kent never thought post-secondary education was a path he would pursue, but when an injury impacted his professional athletic pursuits, he enrolled in the Personal Fitness Trainer Certification Program at Mount Royal. This experience, along with support and encouragement from his wife, led him to a career in nursing where he found a true sense of purpose. A big-picture thinker, Kent developed Micro, an innovative goal-setting framework for nurses that turns theory into action, helps recharge the charge nurse, and develops leadership potential, while also encouraging healthcare workers to slow down and prioritize their own well-being and mental health. Kent is an inspiring leader, a teacher and advocate, a bold collaborator, and a wonderful example of what you can achieve when you're not afraid to push boundaries. For his generous contributions to his field, the Mount Royal University Alumni Association is proud to recognize Kent Saltis with an Outstanding Alumni Award.
So without further ado, I'm going to welcome Kent, and we look forward to your presentation, Kent. Thank you so much for joining us this morning.
Thank you very much for having me. It's to say it's an honor is an understatement. To be asked to speak with this group in Nursing Week is such a tremendous honor. And seeing that video, I will just make the statement. It's very hard for me to see, like even read stuff that I've written, or it's hard to take a compliment. I think as nurses, we're humble to a fault. And oftentimes we see the negative and let it seep in, and we try and the positive bounces off of us. But I'm just so humbled and thanked for that, and the warm welcome and the opportunity to speak to such an amazing group of people today. So thank you again for that. In preparation for speaking here today, I had all kinds of plans. I had all kinds of scripts that I went through in terms of things that I was going to say. And then I threw them all away, and I thought I would just go from the heart. I think a lot of us here today, a lot of the people I've interacted with, a lot of the people in my close circle, got into nursing, got into healthcare because they wanted to lead with their heart, lead with and provide the care that they have within them, and then outwardly to present it. So I'm gonna wing it from my heart, and I hope it resonates with some people, and I hope there's some take homes. I first want to say, I'm a nurse, I'm a husband, I'm a father, as mentioned. Nursing is something that, to be honest, I never thought about. 18 years ago, I never thought I'd be in nursing. I never thought I'd do any of the things that I've done to date. Most of the things that I've done, including research and publication, came after the story I'm about to share. And the story that I'm about to share is something that I sat on for years and never planned to share it. It was kind of part of my healing journey to get over what I'd gone through. But there was just too many positives that could potentially influence and impact the profession that I so dearly love. So as mentioned, I got into nursing kind of on a whim, and it has been the best decision I've ever made. It's led me down roads I've never could have fathomed going down. I've met some of the most beautiful and amazing and influential people, mentors, patients, stories, all through that journey. So listening to some of the remarks when we started this presentation today, it really kind of sunk into my heart. People come from all different walks of life, all different backgrounds, all different stories, all different financial situations. Yet we all somehow in nursing and in healthcare come together for the common goal, which is the betterment of patient care, providing beautiful, compassionate, and kind care to help people go through some of the worst things they're ever going through. So that's what I will say. Before I tell my story, and I've decided I might even share some stuff I've never shared with anybody, some stuff that I'm just kind of holding on to that I'd love to just share because I think it might resonate with some people. But the prequel to my story is I got into nursing a little over 15 years ago. I've been a care aide. I started as an LPN in my journey, and I wanted to become an RN with the goal I wanted to be a critical care nurse. So I achieved those goals. I became an emerge nurse. I loved it. And I thought I knew about healthcare, and I thought I knew about everything until I happened to be a patient, and it completely altered my perspective and what I wanted to do in healthcare. So I thought, and I've seen, and if you worked in healthcare, nursing, anywhere across the world, you see the good and the bad of healthcare, and you see how our actions, how what we do can ultimately influence the care, the healing, and the journey both the family or chosen family and the patient go through. And I thought that I was doing a pretty good job. I'm a nice person. I really like to help people through their healing journey. And, we have good days and we have bad days. And as nurses, we have this coat of armor that we seem to put on. Our world could be imploding behind us. We could be in all kinds of dire circumstances. There could be tragedy going on behind us. Yet we somehow soldier through that. We find this ability to go through. But sometimes that seeps in and then it affects outcomes or interactions with patients or family members, etc. So that's the prequel to my story. I thought I was doing a pretty good job, and I thought the people around me were doing a pretty good job, but we can only see so much. So why I decided, if you've had the opportunity to read my article that I published, I was doing good. I was working. I was loving my job. I was caring for people, and that was fantastic. And then one night I came home off of a night shift and I started feeling a little funny, but I went to bed and I woke up and was having, like I was a young man. I didn't think that there would be a potential for me to have any medical emergencies, but it sure felt like I was having the classic signs and symptoms of a stroke. So my wife, being a stoic woman from Saskatchewan, and I said lots of roots in Ontario, oh, just go back to bed, go back to bed. Luckily, she didn't allow me to go back to bed. My story began by going back to the same place to see my friends that I'd worked with the night before, only I was now the patient. So I came in and I was brought into the emergency room, and my friends had to save my life and help me, sustain my life by the interventions that are required in an emergency situation. And luckily, since I'm sitting here before you today, I went through some things and I came out alive, which I would say that's a pretty good outcome as someone who has still a lot of things they want to do in this world. So I had some wonderful doctors, wonderful friends, wonderful care providers stabilize me and ship me out. The story that I've published and the story that began was when I came to and while I was intubated. So in school, you hear about stories of people that are intubated or under medications or have tubes, lines, etc. And I didn't know the extent of which our actions, while people are, for lack of a better word, waiting to go to the other side, wherever that be. So I was in and out and potentially it was death or life. Those are my two choices in that moment. But it was in those moments when I was fighting for my survival, intubated, incapacitated, and cared for, and someone else keeping me alive, that I was aware of every single interaction that was happening around me. And I didn't know all the words. I didn't know exactly what was going on, but I sensed everything that was done. If someone came into the room and was panicked or flustered or, stressed or brought in their own stuff, I sensed that energy. When someone came in and talked to me calmly, compassionately, and with love and kindness, I sensed that. When someone took the time to provide care to me, even though I was unconscious and incapacitated, the care that was provided in a calm and gentle manner resonated with me. My vital signs actually altered, heart rate came down, etc. When it was rushed or this or a lot of stresses were brought into that, I also felt that. So let's fast forward to the good part. I was extubated and I came to, which was great. Still a little fuzzy and everything else, but now I could hear, kind of see, and I was involved in just observational learning. I didn't know what was learning at the time because I was just kind of getting my bearings coming back into this realm. Um, but I could hear all of the nursing talk, all of the doctor talk outside the room, beside the room at the nursing station. And for those of us on this call that have had the opportunity to work as nurses and been around healthcare, our voices carry, and you've probably heard that many times, our voices carry. Good or bad, our voices carry. And I've been guilty as a nurse of saying things probably that, we're laughing or joking or whatever. But it's when those voices carry to the patients. We don't know what that feels like, but now I know what that feels like. So this is the start of my transformation in what I've done in healthcare so far. So there was some really good conversation, but there was also a lot of stress in the voices. When my thing happened, it was just pre-pandemic, but it was kind of where nursing was seeing the attrition rate of 1 in 3 nurses leaving the profession, stressed, overtaxed, oversensitive. And so a lot of that stress, a lot of the stuff uh, resonated with me as I was just coming back into the beginning stages of rehabilitating to get back to life. So when I was doing that, I was just observing. I didn't know where this would go, but I was observing. So the energy of the conversations outside the room that carried into my ears, into the room, really altered my day, really altered my energy, really altered my experience. So I just wanted to share that when we're talking about anyone, whether you think they can hear or whether you don't think they can hear, it really doesn't matter. All patients have ears, and those words carry. The words that were negative or had a tone of, not the caring that I kind of put forward affected me, affected my energy, affected my ability to heal. And even though I could barely move, I wanted to leave that department. And then the next shift, I had a cool, calm, compassionate crew that would speak with kindness, compassion, care. And then I wanted to heal, I wanted to improve. So the take home message there is all of the things that we say, the energy we use, and the connotations in our words will carry and can carry. And that's something that I didn't understand until I was on the other side of the curtain as a patient. I never really understood how my words, how my energy, how my tone, how things that were said at the nurse's station or outside a room would go, and how that could affect the potential health and healing journey of our clients, of our patients, of our friends, of our families. So that's the one thing, and basically the summary of what I learned when I was on the other side of that curtain. I realized that what we say in any moment can carry into someone's ears and dramatically affect how they come out on the other side of their health and healing journey. And it was one, and I will just speak to one, and it was actually an internationally educated nurse as I was thinking about this. So there was one nurse, ended up being a charge nurse, and had this beautiful accent from somewhere else. And she said, "We're all human beings here. If we don't treat them all the same with kindness and compassion, what the hell are we doing here?" And there were some other choice words that were used, but it dramatically shifted the whole perspective of that nursing crew that day. And my health and healing journey to get out of there and want to prosper and thrive was altered in that moment from someone who was an internationally educated nurse who had said some words of give your head a shake, realize that what we say matters, how we treat people matters, and it doesn't matter of their walk of life, where they came from, who they are. And I'm somebody that lives it, breathes it, works it, and you could consider me one of them. But she said, it doesn't matter who you are, treat everyone with kindness, compassion, and the appropriate care, and let's help them get out of here. And that's one of the only things that stuck with me and has stuck with me to the chance when I went, I got better, I healed, and I wanted to thrive. From that time I got out, those words from that individual altered and shaped how I wanted to proceed with my career as a nurse, as a family man, and as someone living in a society where I really hope we all thrive. So I came out of that and I realized two things. What we're talking about and what we're saying in a healthcare setting or elsewhere has the ability to affect people negatively or positively. I like to think that life is short, as I unfortunately have seen some things to show that it is very short. And you never really think about it until you are that individual who is really struggling or really fighting for survival. You don't know how short and how precious life is. I hope that no one has to go through that to experience what I'm talking about. But when I did, I woke up, I got better, I healed. It took a tremendous amount of time, but those words that were spoken about how you care for others dramatically transformed how I wanted to live. So I went from someone who would be just totally fine working at the bedside to someone who became so fired up and so passionate about advocating for the voices of nurses, for how we do things and where we go with what we do, that it really just set a fire on me that I haven't been able to extinguish. And it's exhausting, I will say it. It's very exhausting. It takes up a lot of extra time. But through that, I've had the opportunity to, for example, even talk to you today, share some things that have occurred, ways in which I've done some transformative care, and how I work with a lot of individuals who really, we do simulation or education about how we communicate, how our body language and everything we do with those interactions with patients can ultimately affect the health and healing journey of that patient. I'm someone that firmly believes that everyone that got into healthcare does so because they want to help with the betterment of patient care, outcome, and provide amazing service in an industry that really, really needs it. We need love, we need compassion, we need care, and we need to be able to pass that on to our patients, whether they're transitioning to the next step in their evolution, or whether they're trying to get back to their baseline, whether they're trying to get back to wherever they are. How we interact with those individuals, how we provide care, the words that are spoken, the body language can ultimately dramatically affect that outcome. So that is my story about what happened to me on the other side of the curtain. When I was a patient, I learned stuff I didn't know. I didn't know that everything we said, every single word that comes out and the energy that we use can dramatically affect the patient outcome. And when we have words that are extremely positive, that carry into our patients' ears, it literally puts a spark in them. They could be super sick like I was, and it made me want to get better. Within a day of hearing someone that said, let's treat this person like a human being. She said, let's treat this person like a human being. Doesn't matter who you are, where you're from. I was able to stand up with assistance and walk, and I was able to get out of there within a couple days. Had that been different and I'd continued to just be treated like an inanimate object, which, was a little bit not great, but it wasn't necessarily because those nurses, the other thing, I could sense and hear the burnout in their voices. And that's something that I've really taken a passion to try and figure out, kind of like Dr. Kareem had mentioned. To avoid that burnout, how can we sustain or how can we support those individuals in overcoming those challenges? Because nursing, your 12 or your 15-hour shifts are extremely taxing. And when for 12 hours of a shift, you're constantly trying to help other people and you have stuff going on in your personal life, it can become very exhausting. But how can we get through a shift, treating each person with kindness, compassion, and help them on their journey? And I can tell you, the individual who helped me see the other side and move beyond to where I was to where I am now, was someone that was tired, fatigued, was on a 16-hour shift, was a charge nurse reluctantly, and just had the ability to treat someone with compassion, regardless of who they were or where they came from. And so with everything I've done, everything I do, and everything I say, I really hope that that is a take-home message. It doesn't matter the walk of life, the person you're caring for, or who you are. The words we use and how we care for them, it's indifferent of language, it's an indifferent of gender, it's an indifferent of everything. Because when you treat people with kindness and compassion and treat everyone as they would like to be treated, which is their story matters, you will help them regardless of the transition and the next stage in their evolution of their healthcare journey. And that's something that really I didn't understand when I first started nursing for the first 15 years of my career. I knew that what we said mattered, but I didn't really know why. So why I chose to share my story was I sat on this specific story for a long time and was never planning on sharing it. But the take-home message is kind of what I just alluded to. Everything we say matters. Everything that we do can dramatically alter the outcome of not only the patients we're caring for, but the family that are there in the room, the loved ones that are there in the room, the loved ones that are out of province, out of country, that are still there with the patient, regardless of where they are physically. So that's one thing. So moving beyond that, my hope, I guess, for the future would be, no matter your life story, we all have the ability to impact someone else's. And people don't come to us in the best times in their lives when they come into a healthcare setting. They are oftentimes, almost always, in a very vulnerable state. People are coming to us for reasons they know, reasons they don't know. They're coming to us for mental health help because they just can't do it anymore. They're coming for cardiac issues. They're coming for neurological issues. They're coming for reasons they don't even know. And they're coming in a very vulnerable state. So I work a lot with individuals that are going into these settings, and I call it going in with a blank slate or a poker face. And that's been pretty much the focus of my career, is trying to go in with a neutral state. Because when we go in a neutral state, we're creating a new and unique relationship with each client we serve and see in a 12-hour shift, in a week, in a month, in a year. And if we don't do that, we carry our baggage, or we carry our bias, or we carry the negatives and the positives, ideally the positives, but we are human beings. Doesn't matter where you come from. As human beings, we are individuals who especially in nurses, we have big hearts and we have big feelings. And, I know you're amazing at pushing down and suppressing those feelings, especially the one things I learned in Emerge. Sometimes as an Emerge nurse to heart, and as an Emerge nurse that still practices in Emerge, we're very good at going from something, the worst thing we've ever seen, having a laugh and getting on with it. It doesn't mean we've forgotten about it. We find this way to suppress it down there deep. And sometimes it comes up, whether it be tears or anger or frustration or whatever. But when we bring that up, sometimes it impacts the relationship that we have with the next client, with the next patient, with the next family member. So that's why I work extensively, specifically with new grads or anyone in a world. And we simulate this experience of going in with a blank slate. So before we cross, I can say cross the threshold of the door. I've heard other people say wash their hands and it resets them. But before we pass, try and go in and create an authentic relationship with that person that you're overseeing, from patient to patient, from family member to family member. And I can tell you what it will do is it might be a difficult venture or a difficult thing for you to do. And I will say I'm still trying to perfect this art. I don't know if I ever will in my working days. But if you can go in and try and create an authentic relationship or an authentic moment with each of your clients, you will provide them the best opportunity for their health and healing, because your ears will be open. Your ability to understand their story will be open. And it will create an environment, and this can be done quickly, but it'll create an environment where they don't feel rushed. And the one thing I didn't allude to in my story is one of the biggest things that bothered me when I was intubated and unconscious and awake and coming to was when I felt rushed. And that doesn't mean that someone couldn't come in for 30 seconds or a minute to make sure I didn't need something, a glass of water, a pillow, a warm blanket, whatever the care I needed at that moment. It was when they came in with a rushed energy. So they came in and almost in a dismissive tone and came in. And that's something that is a really hard thing to break. But if you're able to do that, again, it comes back to, it could take a minute, it could take 30 seconds, but if you come in and start that relationship anew each time, even if you had a negative interaction with that individual, you're coming in and you're creating a new opportunity for you to create a cohesive care environment where you can provide the care that's needed and that individual can get the care they're needed so that they can either improve or decline with dignity. And that is something that's been hugely impactful in my career, is being able to create those authentic relationships, even after just having a very negative experience with that same client. Taking a check, walking in, and then coming in a blank slate and trying to recreate a new relationship or a new opportunity to interact with that client, to listen and provide the utmost care you can. So those are some of the things that I just wanted to share today. But on our good days, and as humans on our bad days, we are in a profession where we have an opportunity to help somebody go through some of the worst thing that they're going through in one of the most vulnerable places they've ever been, in an environment that, regardless of circumstance, almost all of our care facilities are packed to the brim. I know we're getting better at that, but you're taking a vulnerable person in a very chaotic setting and trying to provide calm, cool, compassionate care. Well, you're not trying to, your hair's on fire, but you can't let anyone see that your hair's on fire as you're going in to provide that care. So in kind of just closing out what I wanted to say today, realizing that time is a factor. When we have the opportunity to interact with our clients, with the client's family members, really be cognizant of the energy you have, the tone of your voice, and what you're doing. Because I can tell you from personal experience, when you come in and you treat that person just with a calm, cool, collected manner, you can alter their health and healing outcome. And I'm a living testament of that, because I could have easily gone either way. But when I had the person hold my hand, tell me it was going to be okay, whether I was conscious or not, I felt that. I felt that energy and it was transferred to me. It was evident in how my vital signs were managing. It was evident in how I was being sedated less. And when the environment was chaotic and people were yelling or rushed, that was evident too. So we talked about statistics and kind of manageable stuff. Well, vital signs are something that we can see, and if they're altered based on our interactions, then there's a good chance that they're directly related to what's going on to that person in the room. And it's neat when I went back and I kind of looked at my whole thing, it was definitely there. And I could tell who was working with me at certain times based on how I was doing and how I was improving. So in summary, you're all amazing at what you do. The opportunity to sit here with you today, whether you're nurses or just transitioning from where you came from to be a nurse, we're in such an amazing position as care providers, as nurses, as healers, that is unlike any other profession that you could probably do. And I'm so blessed to be a part of it. And I'm so thankful that there's just hearing the numbers of individuals that are coming in from international areas. Um, it's amazing. Some of the kindness and some of the nicest people I've ever met or worked with came from international areas. Some of my biggest mentors came from other spots. And one story that I was just wanting to share as well was one of my favorite nurses that I worked with was a care aide who had immigrated from the Philippines and needed a job and was an RN back in his home country here. He just worked as a care aide and didn't go back and do any upgrading. One of the best nurses I ever worked with. Taught me so much about kind, cool, compassionate care, and worked as a care aide, and one of the best care aides I've ever worked with, and had more nursing knowledge in his thumb than most of the people I worked with. And I just thought that that was something that was sad that he couldn't at the time, easily transition financially and for other barriers to become a nurse. But I think it's so cool that there's something like the Care Network that honestly, until I connected with you wonderful people I didn't know existed. And I'm so thankful that it does, because there's so many people out there, nurses from all over the world, that are now coming to Canada to provide that care that we so desperately need to overcome all the challenges that we're currently seeing in healthcare. And it's going to be those frontline healthcare providers that stay, get over the challenges that we're seeing in healthcare, and realize that every interaction, regardless of the stress or the fires that are behind us, can alter what's going on. And regardless of how busy those hospitals are, how many beds are in the hallway, how many stretchers are in the hallway, or how full that emergency department is, you can go and take 30 seconds, a minute to create that relationship that will ultimately guide that person through their health and healing journey. And they will remember that. And I always forgot that as someone who practiced for many years without that. When that person leaves as a nurse, I probably forget 90% of the interactions. But then you have people come into you in the grocery store, elsewhere, saying, "Hey, Kent, hey, Ruth, your care that you provided me dramatically changed my life." And those are the interactions that you forget about. But how you treated someone, they never forget it. And they come back. And if you have the chance to ever run into someone just randomly, like I have, the actions or the interactions that you provide that you didn't know changed someone's life, I can tell you, as someone who's lived it, dramatically changed someone's life. So, in closing, thank you for all of the amazing care and things that everyone on this call does. There are some inspirational stories from some unbelievable people that have come here, like Dr. Kareem, and are doing some amazing things. And I just hope that everyone here continues to push for the ultimate care that we can provide to patients. And if you're so interested in doing it, keep pushing to change the profession of nursing, the profession of healthcare, and the provision of care that we provide to everyone across the board, regardless of circumstance or situation. So thank you very much, Ruth, for the warm introduction. Thank you for this opportunity to speak today. And I hope that there was something within there that resonated with anyone on here that maybe they can think about as they go and care for somebody. What we do matters. And we forget that in all the chaos that ensues and surrounds us in healthcare right now. So thank you.
Thank you so much, Kent. Bessie, was there anything came up that we want Kent to respond to?
I don't see any questions, but I know there's a lot of hearts and claps, and I know you've touched many of us, either in a personal level or professional level. We do have some times for questions. So if somebody would like to ask a question, please feel free to add that in the Q&A or in the chat box. More than welcome.
Well, I know many of my colleagues will find this hard to believe, but my comment is, wow, Kent, I'm almost speechless. And that is an unusual state for me to be in. But to have the opportunity to hear your story from the, as you say, from the other side of the blanket is so inspiring. And it so resonates with one of my own mantras, which is that most patients don't know how well you start the IV, but they can tell if you care. And I think this is exactly what you're saying. So such wonderful reflection for all of us to think on our practice, to think of every day, because the nurses at the bedside are really what it's all about. All the rest of us are there to make that happen the best possible way that we can. But that's really where it happens. And I love leading with the heart. I probably have that put on a t-shirt. So thank you so much, Kent, for taking the time and sharing. And I would urge everybody to watch for Kent's next publication, which I'm sure will be equally as inspiring. So thanks again. And you have a wonderful day in British Columbia.
Well, thank you very much. And thank you for the opportunity, for everything. And it's just such an honor to join you today, this morning, bright and early here on the West Coast, but it's a beautiful sunny day out here. So hopefully the same in Ontario. And I just, yeah, I will leave everyone with one more thing. I never thought that I would get into academia. I never thought I'd write. I never thought I'd publish. But as I came to and I realized that our profession needed some work, needed some inspiration, and I was watching all of these amazing new nurses leave the profession and become realtors, pilots, whatever. And that's why I aligned myself with some research, looking at how we can support individuals, how we can do that. And I'm no one special. I don't have, anything. I don't think I'm special. And all I did was I reached out to people that were same and equally passionate about making change. And I have a research project going on right now. I currently have a podcast out on our research, which is really cool, with the University of Victoria. And we're just looking at ways we can alter roles such as charge nurse or leadership or development. So I will leave everyone with an encouraging note. If you're passionate about making change, regardless of where you came from, who you are, what you think you can do amazing things by just continuing to push and lead. Like I said, I didn't realize that I said that and it stuck out so well with you, Ruth. But if you can lead with the heart and realize our profession needs help to get to the next chapter, just keep pushing. Write, publish, reach out, do whatever you want. As long as you lead with the heart, I don't think you can do anything wrong. And we can always make our profession better. So just keep pushing. If you're passionate about it, keep pushing.
Thank you so much, Ken, for speaking from your heart. It's truly very humbling to hear what you said, particularly being a patient. I admire your courage to show your vulnerability. A lot of times we nurses think that, we have to be the hero, we need to be rescuing people. But for you to share your story in one of those darkest days of your life, and you survive it, and now you can bring light into that darkness. Your courage, I truly admire, and I hope that we all learn from Ken. I truly have learned from you. It's not easy, and your word about publication, about research, and not afraid to speak up is right on. We all have to do that. I remember as a young nurse, I don't want to say a word. And then I was tapped on the shoulder by one of my nurse educators and say, Ruth, why don't you say something? I know that you have a lot to say. And I say, no. I speak with an accent. No one will understand me. So I'm sharing this with all my IEN colleagues as well. A lot of you speak English as a second language, or even if you speak English, you speak English with a different accent, right? There's nothing to afraid. As my nurse educator friend Sue told me, is what you have to say matters. It's not your experience matters, not the accent. If I want to listen to perfect accent, I turn on the BBC for the British accent, and the CBC, the Canadian accent, or ABC for the American accent, and then probably something in Australia as well. So I learned a lot from you, Ken. Thank you so much for speaking from the heart. As we all know, nursing is caring, and caring needs a heart to care. So thank you so much. Hope that you will continue your collaboration with Care Center and share those wonderful stories about that they have make a difference in your journey as a patient, and now you become a better nurse from those experiences. I'm sure that's what I'm gathering from your speech. Thank you so much.
Thank you.
Hope you can participate in next 4 days events. We have a lot coming up to celebrate Nursing Week. And on that, I'm going to turn the mic back to Bessie, so that Bessie will show us a message from other program manager, Megan Wanko. She's going to share a 2-minute video on coming to Canada. So take it away, Bessie.
Perfect. Thank you. And before I do that, I'm going to take the opportunity. We did have some nice, thankful messages, and I do want to share these with Kent and everyone. Kent, thank you for sharing the beautiful lesson. So proud to know you and learn from you. Story resonates with me from another attendee. Thank you, Kent, for sharing your story. And this storytelling helps us understand the effects of what we say and do as nurses. Part of that transformation in nursing is triggered by learning like you've shared today. Thank you for sharing, Kent, so inspiring story. Your story is one of a kind. Thank you for sharing your story. Experience indeed is the best teacher, and yours brought a shift in your mindset. And I think in our mindset as well, transforming, as you said, patient's outcome is in our hands, in our voices, in our tone, in our words. So having said that, I will now pass it on to Megan's video, where she encourages us and tells us how we can come to Canada and start that journey of transforming ourselves and the health that we provide to our patients.
Hello, everyone, and thank you for being with us today. My name is Megan Wanko, and I'm the Program Manager for Care Center's Pre- and Post-Arrival Supports and Services program called PASS. As we begin to celebrate the start of Nursing Week 2025, we would like to acknowledge the remarkable achievements and perseverance of internationally educated nurses who have chosen Canada as their new home. Your journey is a testament to your dedication, resilience, and passion for nursing. Your unique perspectives and experiences enrich our healthcare system, fostering a more inclusive and culturally sensitive environment. Your accomplishments are a source of inspiration. For internationally educated nurses who are still on their journey to make Canada their home, I am proud to share with you a valuable resource that supports you on your journey. I am pleased to inform everyone that the PASS program now offers both pre- and post-arrival supports before arrival and in every province and territory across Canada. Through PASS, you can access free information and resources on credential recognition and licensure processes, job search strategies and resume building, cultural adaptation and settlement support, nursing language communication training, and much more. By registering with the PASS program immediately after immigration approval, whether inside or outside of Canada, you can gain a head start on your integration journey. Funded by Immigration, Refugees, and Citizenship Canada, the PASS program is a testament to Canada's commitment to supporting internationally educated nurses. To all nurses, I offer these words of encouragement. Your hard work, determination, and compassion are valued and recognized. You are not just nurses, you are ambassadors of care, bridging cultures and communities. As we move forward with Nursing Week 2025, let us celebrate your achievements and recommit to supporting your continued growth and success. Together, we can build a more inclusive, equitable, and exceptional healthcare system for all Canadians. Please join us tomorrow as Holly covers how to get started on your journey to nursing in Ontario with Care Centre for Internationally Educated Nurses.
So a big thank you to Megan as well. And I know that we have her on the call, and anyone else that would like to join us before we close the day to take a snapshot. It is the virtual world. Pictures are taken differently. So if you would like to join our screen here, please raise your hand and I will admit you. While we're doing that, and I'm going to be waiting for some of you to volunteer so we can come in and take that picture. I would like to remind everyone we will be here again tomorrow. Today we highlighted very important aspects about how we can transform the health we provide with compassionate words, with our compassionate care. Tomorrow, we will be focusing on the role of professional nursing associations. We will have here the nurse practitioner Lamo Dalkar from RNAO, from the Registered Nurses Association of Ontario, empowering nurses to transform our health and healthcare system. So please feel free to register and join. We'll be expecting you all. And I see some hands here. I'm trying to multitask, so give me a couple of seconds here while I admit everyone to take wonderful pictures before we end today's event.
Hi, Loy. Good to see you.
Yeah, it's
Good
great
to
to see
see,
our friends.
good to
Yeah.
see all of you. It's just
Yeah.
amazing. I was just, smiling throughout from 6 in the morning here, 6:30. So I just love you all.
Thank you.
Sending
We
you
miss
our
you.
love.
Yeah, we
And
really miss you.
congratulations, Ruth, for the upcoming award. I will just be there just to see how smiling and everybody's, you know what, it shows how much you've been working tirelessly, but with compassion and love. And that says it all, seeing how care has been growing. I've been following every time to know how, you are doing, and congratulations, all of you.
Thank you. Thank you so much, Loy, for your very kind words. Loy is the first winner of our Joan Lastman Award, which is awarded to a nurse demonstrated excellence. So very, very happy that you stay with the family and contribute. Actually, Roy have worked as a case manager as well. So, and then after that, she was a facilitator and instructor, continue with the care center. Thank you so much, Roy. We miss you and hope we'll meet in person sometime soon.
I'm looking forward for that. Thank you.
All right. Amazing stories. I know some tears came to my eyes, and I think the speakers today really touched our hearts as internationally educated nurses and non-internationally educated nurses. We have something very important in common. We have that compassionate heart, and that's something special inside that pushes us through. So we'll push through to see you tomorrow again. And if anybody else wanted to share, if nobody else wants to share anything else, we will end today and see you all tomorrow. Happy Nursing Week.